Professor Dame Parveen Kumar, DBE, FRCP. Thinking about medicine. Introduction. Plumbing and philosophy are both activities that arise because elaborate cultures like ours have, beneath their surface, a fairly complex system which is usually unnoticed, but which sometimes goes wrong. Mary Midgley. I once attended a lecture by James Ladyman, a professor of philosophy at the University of Bristol. He was required to produce a mission statement for the philosophy department. He was a bit puzzled, as he felt that a department of philosophy would normally be expected to do what it says on the tin, but being an agreeable chap, he agreed and came up with analysing concepts in the Bristol and Avon area. Whether this mission statement was ever used, I do not know. However, if we leave Bristol and Avon out of it, analysing concepts is a pretty good definition of philosophy. Philosophy is not something obscure, requiring the heroic pose and mental physique of Rodin's The Thinker. We analyse concepts and answer questions all the time, from do you want anything at the shops, to is this patient's grieving normal or pathological? Philosophy is the attempt to do this better, to think more clearly, to use our reason in a structured way in order to avoid being led astray by wrong assumptions, wishful thinking and shortcuts. So is it all just common sense? Well, not quite. Our brains are adapted to cope well with everyday life. Do you want anything at the shops is not too demanding. But our brains are not only wired for reason, they're also wired for our desires. We seek answers that we like. And we use shortcuts. We will believe answers that have been okay before or that are approved by our social group. Philosophy provides us with a box of tools that give us a better chance of getting right answers. Philosophy is not a path to finding the meaning of life, although it can be a path to living a better life. Philosophy is not a guarantee of getting the right answers to dilemmas, although it should help us to sort out better answers from less good answers, discarding quite a few wrong answers along the way. Of course, philosophy is not one simple thing, any more than medicine itself, or physics, or any other discipline. This book mainly uses the Western philosophical tradition. It mostly follows a particular part of that tradition, so-called analytic philosophy. This is not to say that other traditions would be less interesting, but that is not this book. This book is a sightseer's map, marking a few tourist highlights. It does not drill down into the geology of the world's deeper foundations, and there are far too many highlights to mark them all. The book misses out far more than it includes. I talk both about medicine and about healthcare. Quite often these may be interchangeable, but I take medicine, my area of professional interest, to be a subcategory within healthcare as a whole. I hope this book may illuminate both. This book should also contain a health warning, especially for clinicians. Thinking can be startlingly addictive and will not necessarily help you to please your managers. But it most certainly will help you to think, and it may empower you to flourish as a human being. And this book is personal. In the human world there is no absolute objectivity. Even science is a human activity, and philosophy most certainly so. I was a clinician for 35 years, and the book is written from that perspective. There are quite a few things that I care about because I think they matter. So here and there I make this obvious, and I hope you will agree or disagree with me as you please. This book leaves out most of the psychology and sociology of medicine, although there is a huge overlap. I wrote about these in my 2001 book, Thinking About Patients. I'm immensely grateful to Taylor and Francis for reissuing this. I hope that Thinking About Patients and Thinking About Medicine will, together, form a sort of everything you wanted to know about healthcare but were afraid to ask. This book brings together some of my previous published work from articles and book chapters. I've indicated the main places where I've used such work, and I'm grateful for the different publishers' permissions to reproduce this material. I'm immensely grateful to Professor Trevor Stammers and to Dr. Lottie Elton for their kindness in offering me feedback, chapter by chapter, as I wrote this book. The book is much the better for it. Errors, of course, remain my own, and I'm grateful to Dr. Andrew Papanikitis for encouraging me to finally write the book and for putting me in touch with the wonderful Jo Costa from Taylor and Francis, together with her ever-helpful colleagues. It is impossible to write a crossover book like this without using some technical terms. I hope I've explained these, but there is also a glossary at the end, not to mention a short guide for further study. Thinking is meant to challenge the status quo, so let the subversion begin. David Misselbrook.